My name's Phoebe Beedell and I'm an academic researcher working on the qualitative project about ethical issues in older people's self-funded care. I've been working with a wonderful group of about 10 lay co-researchers, and they're going to tell you about their experience and what they've been doing over the last 3 years. Obviously, the lockdown has disrupted a lot of our dissemination activities, and this short film is just the beginning of our online dissemination journey.
So, in the early stages of the research project on self-funding, we held meetings to identify suitable methods to gather data. The main strand of this involved designing interview questionnaires to be delivered to older persons, either in their homes or in community settings. We also invited stakeholders, comprising local authority managers, commissioners and third sector partners to engage in interviews. And finally, a separate set of questions delivered to carers or persons involved in arranging care for an older person who is self-funding. All of the interviews were recorded with consent and delivered within a university and externally approved ethical framework for the research.
As a lay assessor of health and social care research, I have been involved in research projects at the University of Lincoln and Sheffield University. Working on this project has given me the opportunity to put qualitative research theory into practice. This is most unusual for a service user to be involved in to such an extent. We have used the transcripted interviews to produce a codebook of themes which occur regularly. These themes from the older people, the carers and the stakeholder interviews are then merged. By analysing all the interviews, we are able to provide hard evidence in the form of quotes to underpin our research.
Over the course of the research, we've held 5 knowledge exchange events, which have involved the academic staff and co-researchers meeting with commissioners, providers and practitioners of care. We've generally had a theme and used the actual scenarios from the interviews, and the co-researchers have provided a facilitator and note-taking role. We're now in the process of organising our final and 6th knowledge exchange, which will be an online event, with the additional benefit of reaching a wider audience.
So here's some of our outputs. Last year, we took part in the Frequency Festival, where we had a virtual reality art experience installed that took you on that care journey. We took part in cafe conversations. We produced a tree of knowledge with accompanying leaflets. We're currently working on a fabulous little booklet giving useful tips on seeking care, and it's based on the knowledge of the care journey from the co-researchers.
At our monthly team meeting to discuss potential outputs from the research, we explored ideas to present the interview findings in a 3-dimensional visual format. Our discussions bounced around with the analogy of the tree of life and how people grow and change throughout their lifetime, and like trees, gain more unique characteristics. For the tree, the environment and extremes of weather takes its toll, and for us, our life experience shapes us, and the changes continue through into our later life. After blossoming and being in full leaf, the leaves change colour and fall. Our colours change too, along with our need for support and relationships with friends and family. The tree depicts the complexity of issues people face, and how there are many branches to follow in the process of finding and organising self-funded care, and managing that care to meet the changing needs. Each leaf carries a message from the research, either as a direct quotation or questions and outcomes.